Elahere is a prescription medicine used to treat adults with folate receptor, alpha-positive ovarian cancer, fallopian tube cancer, or primary peritoneal cancer who have not responded to or are no longer responding to treatment with platinum-based chemotherapy and have received 1 to 3 prior types of chemotherapy. Active ingredient mirvetuximab soravtansine. Indications: Elahere injection is used to treat certain cancers, such as epithelial ovarian, fallopian tube, primary peritoneal. Mirvetuximab soravtansine works by slowing or stopping the growth of cancer cells. How to use: the recommended dose of Elahere is 6 mg per kg adjusted to ideal body weight, administered once every 3 weeks, 21-day cycle, as an intravenous infusion until disease progression or unacceptable toxicity. Use Elahere intravenous exactly as directed on the label or as prescribed by a doctor. Do not use in larger or small amounts or for longer than recommended. Follow directions on a prescription label and real medication guides or instruction sheets. Your doctor may change, delay, or permanently discontinue your treatment with mirvetuximab soravtansine if you have certain side effects. Mirvetuximab soravtansine is usually given every 3 weeks as an infusion into a vein. Your doctor will decide how many cycles you need. You may be given as medications to help prevent serious side effects or allergic reaction. Keep taking these medicines for as long as your doctor has prescribed. You may need frequent vision exams. Your doctor may prescribe eye drops before and during your treatment with mirvetuximab soravtansine. You should use these eye drops as directed by a doctor. Precautions: before using mirvetuximab soravtansine, tell doctor or pharmacist if you are allergic to it or if you have any other allergies. These products may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist a medical history. This drug may cause vision changes such as decreased or blurred vision. Do not drive, use machinery, or do anything that needs clear vision until you can do it safely. Side effects: get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have dry eyes, sensitivity to light, blurred vision, eye pain, or new or worsening vision changes, cough, chest pain, trouble breathing, shortness of breath, or numbness, tingling, or burning pain in your hands or feet. Common side effects may include abnormal lab results, nausea, stomach pain, diarrhea, constipation, fever, mouth sores, skin sores, sore throat, cough, or pale skin, tiredness, feeling lightheaded or short of breath, cold hands and feet.